Welcome to this explainer. Look, if you're joining me today, chances are you or someone you care about has already gone through the whole rigorous process of catheter ablation surgery for atrial fibrillation. You put in the hard work, you got through the procedure, and you were probably hoping to finally be free of those terrifying irregular heartbeats once and for all. But then, boom, you feel that familiar flutter in your chest again. The anxiety just rushes right back, doesn't it? You start wondering, did the surgery fail? Was all this for nothing? Well, I want to start off right here, right now by saying I completely get it. It's so understandable to feel disappointed and scared. But today, we're going to look directly at the medical realities of post-ablation recurrence based on insights from cardiovascular specialists, and I'm going to show you exactly why you really shouldn't panic.
So let's dive into this with a powerful reframe straight from our source material. Cardiologist Dr. Jen hit the nail on the head when he said, recurrence is by no means the end. I just want you to let that sink in for a second. Feeling those symptoms return does not mean you're back to square one, and it absolutely does not mean the treatment failed you. If you've been lying awake, losing sleep, worrying that your body rejected the cure, well, this explainer is going to equip you with the facts you need to take a deep breath and take back control.
The absolute crucial point to understand here is that recurrence does not equal failure. Medical professionals actually view achieving a normal heart rhythm as a multi-step journey. Now, thanks to modern advancements, sure, many people are cured in one go, but for others, it's totally normal to require a second or even a third treatment. Specialists view this as a cumulative approach. Think of it like building a house. It's not, oh, surgery 1 failed, let's try surgery 2. It's more like surgery 1 laid the foundation, and surgery 2 or 3 builds on top of it to complete the job. It's a designed, phased process.
And when we actually look at the data behind these recurrences, a really clear pattern emerges. If you have paroxysmal or intermittent AFib, meaning your heart kind of flips between a normal rhythm and AFib, the recurrence rate is right around 25%. But if you have persistent, continuous AFib, that rate jumps to 35%. Honestly, this should be pure reassurance for you. Between a quarter and a third of all patients go through this. It's incredibly common. But this also brilliantly illustrates a vital medical truth. Treating atrial fibrillation in its early intermittent stages leads to way better success rates. The longer the heart is allowed to just stay in an irregular rhythm, the more it physically changes and enlarges, which naturally makes the success rate of the surgery drop.
Okay, so we've established that this is normal, and you don't need to panic. But that brings us to a super practical question. What should you actually do if you're just sitting on the couch and you feel those palpitations start up again? It's time to shift away from anxiety and get into a structured, proactive mindset. Because, not all flutters are created equal, and your immediate reaction is going to depend heavily on the timeline of your recovery.
Let's look at the 3-month window to understand how a healing heart behaves. Immediately following a catheter ablation, your heart has literally just undergone trauma. It's inflamed, it's trying to heal, and ironically, the treatment itself makes the heart temporarily unstable. Because of this, it is incredibly common to experience a temporary spike in arrhythmias within the first 3 months. Doctors totally expect this to happen. So if you feel palpitations early on, it might just require simple observation. Plus, there are plenty of reasons for rapid heartbeat that have absolutely nothing to do with AFib. The very first and most vital step is simply having a doctor confirm if what you're feeling is truly atrial fibrillation or just a normal palpitation from the healing process.
Which brings us to 3 choices post-recurrence.
If you're past that 3-month window and a recurrence is actually medically confirmed, you're not out of options. You've basically got 3 clear choices. Step 1 is re-ablation. If your symptoms are really severe, or if the AFib is starting to cause heart failure, going back in for another catheter ablation to completely knock out the arrhythmia is often the best choice. Remember, getting a second procedure is a totally normal part of the overall cure. Step 2 is medication. If the AFib is infrequent and the symptoms are super mild, your doctor might just choose to manage it with drugs and keep an eye on things. And then step 3 is observation without medications. Now, this is reserved only for patients with incredibly infrequent episodes, virtually no symptoms, and critically, a very low risk of stroke. But guys, I need to be absolutely crystal clear about this. You must never choose option 3 on your own. Do not go rogue and stop taking your medication just because you want to. That decision has to be made strictly through a consultation with your doctor based on the exact condition of your heart.
Now let's pivot to 5 everyday habits that practically invite recurrence. Because whether or not your AFib returns isn't just up to the surgeon's skill, it's heavily influenced by your daily routine. Number 1 is alcohol, and it's pretty simple. The risk of recurrence is directly proportional to the amount you drink. More alcohol equals higher risk, period. Number 2 is obesity, which we're going to look at a bit closer in just a second. Number 3 is sleep apnea. This one is a massive hidden danger. If you have sleep apnea, you literally stop breathing at night. That starves your entire body, including your heart, of oxygen. And that oxygen deprivation puts intense strain on the heart muscle, making it the perfect breeding ground for AFib to come back. Number 4 is simply a lack of sleep. And number 5 is high salt intake. If you're struggling with recurrence, you really have to take a hard look at these habits and ask yourself which of them you might be actively feeding.
And to show you just how sensitive the heart is to these lifestyle factors, consider this staggering number: 10. According to our cardiovascular sources, gaining just 1 single kilogram of body weight, that is only about 2.2 pounds, increases your risk of AFib recurrence by a massive 10%. I mean, think about that math for a second. If you gain 5 kilograms, your risk of the surgery failing spikes by 50%. Your lifestyle is literally the co-pilot of your medical treatment. You just can't rely on the surgery alone if your body is actively working against it.
Let's wrap things up with some common FAQs and modern countermeasures.
Let's clear up some of those lingering anxieties. This is usually the very first question a doctor gets after a recurrence is confirmed. People want to know the physical limits of their own bodies, right? Like, is there a cap on how many times a surgeon can safely go in and do this procedure?
Well, the clear, definitive answer from the medical community is generally up to 3 times. Because untreated AFib physically alters and enlarges the heart over time, there's always a baseline chance that the arrhythmia will stick around despite treatment. But specialists pretty much agree that 3 attempts is usually the safe and practical limit for trying to permanently restore a normal heart rhythm using the catheter method.
Next up is a really crucial, life-threatening concern. Atrial fibrillation is notoriously dangerous, not just because of the weird fluttering, but because it causes blood to pool in the heart, which leads to clots. So if the AFib comes back, does that mean the risk of a stroke comes back right along with it?
The answer is a firm yes. If your atrial fibrillation has recurred, your risk for suffering a stroke is absolutely present. This is exactly why doctors prescribe blood-thinning medications. And this brings us right back to that golden rule. You must never, ever stop taking your blood thinners on your own, even if you feel perfectly fine. The only time you should ever stop this medication is if your doctor specifically runs an evaluation, determines your individual stroke risk is exceptionally low, and explicitly tells you to stop. Otherwise, you keep taking them.
So, how do we stay ahead of all this? What's the best way to catch a recurrence early so you can get back to your doctor and choose one of those 3 action plans before the AFib has time to get worse?
Well, the answer is actually sitting right on the wrists of millions of people around the world right now. Wear a smartwatch. Technology has completely transformed patient care here. Specialists highly recommend investing in one. They aren't just for tracking your steps anymore, folks. A modern smartwatch monitors your pulse continuously and can actually detect the exact irregular rhythms associated with AFib. If an irregularity happens, it shoots a notification straight to your phone. And here's the absolute best part. Doctors actually use this data. In a real clinical setting, your physician can look at your smartwatch's logged history to see exactly when your pulse spiked or dropped. It takes the guesswork entirely out of your diagnosis. It really is the ultimate proactive tool.
As we wrap up this explainer, I want you to leave behind any feelings of defeat. Recurrence is a hurdle. It is definitely not a dead end. Just remember this final thought from our sources. Reevaluate your lifestyle and remember you have options. You have the option of a second procedure, you have the option of medication, you have the option of strapping on a smartwatch and actively monitoring your own health, and most importantly, you have the option today, right now, to cut back on alcohol, watch your salt, and protect your sleep. So my question to you is, which of these everyday habits are you going to take control of first? You're equipped with the knowledge now, and you are entirely capable of navigating this journey to a healthier heart. Thanks so much for joining me on this explainer, and I'll catch you on the next one.